Hi, my name is Akosia Odum, and I'm going to be a nurse for baby girl Odum, and I'm here to do a neonatal head to toe assessment. I'm in the room already. I've washed my hands. I have my gloves on. I've introduced myself to mom. I've observed privacy by pulling my curtain over right there. I've checked for safety by checking baby's armband with mom's armband, and it's matched up. Mom said baby was born vaginally. There was no complications or trauma during delivery. With that being said, I'll go ahead and listen or do baby's vitals. Looking at baby's overall level of consciousness, baby is quite alert. I will take advantage of that and do all my listenings now. First, I'm going to listen for baby's heart rate for 1 full minute. It's supposed to be between 110 and 160 at baby's apical pulse. Baby's heart rate is normal. I will then listen for baby's breath sounds. Baby's breath sounds are normal. My next is to listen for bowel sounds, and I will do that in all 4 quadrants. Baby have active bowels. Next is my respiratory rate, and I'm going to check that right here for 1 full minute. Supposed to be between 35 and 55. And that is normal. My next is to check baby's temperature, and I'm going to do that auxiliary. That's under baby's armpits. I'm going to put the thermometer right here and press baby's arm against baby so I can get an accurate reading. Baby's temperature now is 37.5 degrees Celsius, which is within the normal range. Next, I'm going to weigh baby. Baby is wearing diaper, so I'll weigh the diaper and I'll put the sheet on a scale. I'll weigh baby and I'll take the weight of the diaper from baby's weight to get the baby's actual weight. Next, I'm going to measure baby's head circumference. That's my tape measure. I have that 10 centimeters. I'm going to measure baby's chest circumference. It's supposed to be across like that, the nipple line. And that is 9 centimeters. Normally, the head circumference is supposed to be bigger than the chest circumference. Next, I'm going to measure baby's length. From the head all the way down to the tip of baby's feet. And I have that also 16. Okay, with all my vitals done, I'm going to go ahead and check baby's skin. Before I came in, baby was crying and baby's cry was appropriate. I'm looking at baby's body. Every part of baby's body is intact. Baby is not labored. So baby is not in pain. I'm going to look at baby's skin. The first one I'll talk about is vernix. Vernix is that white cheesy coat that normally forms around baby's skin, and that protects the baby's skin. The next is malia. It's a small white bumps. It normally forms around bridge of baby's nostrils, and also it could be on baby's cheek or baby's chin. Next is lanugo. Lanugo is baby's hair that comes on baby's shoulder. It could also be behind baby's ear or on baby's torso, and this hair falls away. And then next is erythema tosicum. That is acne, or I would say red spots or rash that also come on baby. That also goes away with time. And then we have Mongolia spots. These are small birth masks that come on baby. Last, we have petechiae. These are also red masks that come on baby as a result of trauma during delivery. Now, with all that said, I'm going to go ahead and start the head to toe. I'm going to start from baby's head. Baby's head is fine. It's round and it's non-cephalic. I'm going to start to palpate the fontanelles, both anterior and posterior. So what I'm going to do is I'm going to look out if the fontanelles sunken or it bulges out. That is how I will know if baby is having little fluid or baby is getting more fluid. And also I'm going to check for molding. This happens with babies that come through the birth canal. And we also have carpets also with babies that come through the birth canal. Carpet is like generalized trauma, generalized edema that happens with babies that come through the birth canal. Next is baby's face. Baby's face is symmetrical. I'm going to look at baby's eyes. Looking at it, is baby's eye aligned with baby's ears and baby's nose. I'm going to look into baby's eyes with my pen light. Okay, baby's iris is slightly gray. Looking at baby's pale, the pupil is round and it reacts to light. Next is baby's conjunctiva. I don't see any infection. There's no sign of infection in baby's eye. We also have strabismus, which mom was worried earlier on because baby was having lazy eyes. But mom, don't worry about that because that will also go away. Next is baby's ear. Baby has 2 ears and it's well formed and it's in line. It aligns with baby's eyes. So it's also well formed. Next, I'm going to check baby's nose for patency. I'm going to occlude one nose and see if baby labors. He doesn't. He's breathing normal. She's breathing normal. So baby's nose is patent. I'm going to look in baby's mouth. I'm going to check for palate. I'm going to stick my gloved finger in baby's mouth. I'm checking if it's intact, and also I'm checking if it's hard, soft. I'm also checking for baby's sucking reflex. Baby is sucking good. And I'm also going to do routine reflex. Baby had a good routine reflex as well. With that said, I'm going to go and check baby's neck and clavicle for any signs of trauma that happen during delivery. I don't see any signs of trauma that happen during delivery with baby. Everything looks normal and good. My next is baby's chest. Baby's chest doesn't look barrel or it's not bulging out. With breath sounds, I already listened to baby's breath sounds when I was doing vitals. I also listened to bowel sounds when I was doing vitals, and they were all normal. I'm looking at baby's abdomen. I don't see any distension or bulgeness in baby's abdomen. I'm going to check baby's umbilical cord. I don't see any signs of infection. It's dry and everything looks okay with baby right here with baby's abdomen. My next to check, I'm going to check baby is a girl, so I'm going to check for baby's genitalia. I want to be sure that baby's labia is covering baby's clitoris, which is normal because it's covering baby's clitoris. If baby were supposed to be a boy, I will be looking out for baby's meatus location, and that was supposed to be centrally. I've also would have palpated baby's testis to be sure that it's also descending. With that said, I'm gonna turn baby to the back because I want to check baby's spinal alignment. So I have baby like that. Baby's spinal is aligned normally, and I see that there are no spaces in between them. I'll also check baby's anus patency. I see that all the muscles also skews this together. So baby is all good over here as well. I'm going to look at baby's extremities. I see baby's arms and baby's legs. They are all intact, and baby is able to move them equal bilaterally. Baby's fingers, he had 5 here, all fingers, all toes. I don't see any feet clubbing. Baby have all 5 toes on each leg and all 5 fingers on each leg. I'm going to go ahead and also continue with my reflex. I already did routine and sucking. Baby was swallowing earlier on when he was being breastfed. I will just go ahead and do my palmar reflex. Baby had good grasp. I will do my plantar reflex. It's also good. my last one to do is the Babinski. I'm going to rub my hand on the baby's feet. Yeah, baby's toes are flaring out. So yeah, that's a good Babinski sign as well. With all that said, the last that I'm going to assess is baby's alertness, or if baby is sleepy or whatever. Baby is still consciousness. Baby is still looking quite alert. So that would be the end of my neonatal health assessment. Mom, do you have any question about this assessment? Mom says no. So I'm going to take my gloves off. I'm going to wash my hands. I'm going to document, and then I'm going to wrap baby up once again. Swaddle baby for mom, and I'll give baby back to mom, and I'll be out of here. If mom, you need anything, just call me.